Hi, welcome back to the channel. I'm Dr. Sylvia. I'm a general practitioner, a GP, and a health educator with AskAwayHealth. And today, on the 5th episode of our Friday live class, we're going to be looking at a few things around women's health topics, specifically going to be talking about fibroids and pregnancy. Now, these topics are usually based on questions that my viewers have posted in response to a video I've published or a comment I've put out, and people want to clarify. Okay, so for the first question we're looking at is, how can one get pregnant with 4-centimeter uterus fibroid? So this is a question that one of my viewers has put through. So I'm going to start by sharing my screen, and then we can talk about this. This question. And just a second. Make sure I've got the right, it's up, and make sure you can get all the information that's available. So just bear with me. Here we go. So I think we should have that image up, and I wanted to share this image of a womb. This is obviously an operation going on here, a womb with fibroids and surgeries going on, but I wanted to give us a sense of size. So this question refers to a 4-centimeter uterus fibroid. According to the tape that's been held, I don't know how closely you can see, but this is going beyond 15 or 16 centimeters in terms of the size of the entire organ. So if you think about a fibroid of about 4-centimeter mark, I think it's sort of here. This bit, my cursor is not doing what I wanted to do this morning, but yeah, so sort of around that area, size of a fibroid. So it's not a huge one, but it is significant, and I wanted to give us an idea of the size when we're looking at fibroids, because what is important in terms of the fibroid is not just the fact that it's there, it is where is it, what's the size, and where is it, and what type of fibroid it is. So I'm going to explain that a little bit better. Now, as a reminder, a fibroid is a benign growth within the womb. And please go ahead and check the channel for our fibroids playlist, where we talk about this extensively. We discuss different types of fibroids. We talk about how fibroids happen. We look at risk factors for developing fibroids, and as much as we know anyway, because medical science doesn't altogether know exactly why fibroids happen in some instances. We know some of the issues, things like hormone, estrogen related to developing fibroids, but we don't know everything about how a fibroid develops. There are lots of research thoughts, research opinions, but not an exact cause. So please go and have a look if you're looking at details. We of course talk about treatments. I talk about symptoms of fibroids. So we've got several videos in this channel looking at fibroids. So please go and have a look at them. But today in particular, we're looking at effect on fibroids. The symptoms of fibroids are many. Different women have different fibroid symptoms. We talk about fibroid pain as one of the most common symptoms, of course. Things like the fibroid growing so large, it's putting pressure on other organs and contributing to not just pain, but problems like constipation or problems with passing urine and so on. But when it comes to pregnancy, I think it's really important to state a few facts, which is that it is possible to be pregnant with fibroids. It is possible to have fibroids and to fall pregnant and then to go on to have a natural birth in some cases. So there are possibilities, and that's why it's always good to look at individual circumstances. I think fibroids is one of those conditions where one pill does not suit everyone. So there's a wide variety of different treatments or treatment options, because there are a wide variety of different symptoms that don't just happen in one person but can affect women differently. Even in women who have fibroids of similar size may have different symptoms. So it's good to bear that in mind. Okay, I'm going to stop sharing this photo, and I'm going to pull up another one that I think is also of interest, and I want to use that to explain about one of the things I've mentioned that's relevant to getting pregnant with fibroid. So what you're looking at now is the image of the womb with a baby, a growing child within the womb. But what I want you to pay attention in particular to is the layers of the womb. I'm not sure how much. Let me just take away this. Let me hide this so you can see this better. Yeah, okay, fine. So you can see the image, and I wanted to look at particularly the layout of the womb. So just looking at the womb in section, broadly there are 3 layers. Okay, from the top to the bottom, looking at the top of the bottom, baby's head is towards the bottom. You can see the cervix. So this is just to allow us to orient ourselves properly around this picture. So this is the womb as it would be in a woman who's standing upright. Baby's head is down, which is sort of the usual more common presentation for the baby. And you have the cervix, which is the neck of the womb at the bottom. But what I'm interested in this video are broadly the three layers of the womb. There's the outer layer, okay, there's the outer sheath. So if you think about the outer covering of the womb, and there's the middle layer, which is usually a muscle, which is a muscle layer, and you have the inner layer, which is where the baby in its water sac or amniotic sac sits, where the placenta is fitted to. So those are the three main layers of the womb. Now this is important because we've said about the issues that affect a fibroid and pregnancy are the size, the type, and the location. So I'd like you to just have it at the back of your mind that we're talking about three different layers of the womb. Okay, now we've got this. Let's come away from this image and let's get another one up, because I think it's useful to have to see these things as we're talking about them. It sort of makes it more you can relate better to it, can't you? So let's put this next picture up, and then hopefully makes it clear what I've been referring to. So this picture looks at the types of fibroids, and I'm going to combine this now with the location and types of fibroid. In terms of location, a fibroid can either be located in the first layer, the outer layer, which we talked about in the previous picture, could be located around the middle layer, that's that muscle layer, or in the inner, or come from the inner layer. So fibroids, that's when we talk about the type and location of fibroids, that's what we're referring to. Where are they positioned? Where are they coming from? So if you look at this first structure here, and let me just see if the cursor is doing its own thing today. But the first one up here, the subserosal fibroid. Now that's coming up from the outer layer. You can see it's coming up from the outer layer. It's unlikely to do anything to a baby growing within the womb. This is the womb cavity. This bit in the dark red is the womb cavity. So it's quite unlikely for that fibroid that's growing out here, it's known as a subserosal fibroid, quite unlikely for it to do anything to the baby now growing within the womb cavity, or within the womb space. Don't forget that fibroids do grow in pregnancy. The pregnancy hormones can influence as the baby's growing, fibroid can be growing. So potentially this fibroid here can grow, it can cause pain. Now commonly women who fall pregnant and with fibroids may have this type of fibroid, the subserosal type of fibroid, which doesn't really do anything to the inner lining of the womb generally. So that's one of the types that a woman can have, and she can go ahead to get pregnant and carry her pregnancy to term, because that fibroid is away from the inner part of the womb. But it might grow bigger, it might cause her to have pain when she's pregnant. So I'm not saying that there may not be issues, but generally this may not affect the ability to get pregnant or ability to carry a pregnancy. Now, other type of fibroid is the one that grows within the muscle of the womb, the one that grows within the muscle of the womb. Now, we generally refer to that as an intramural fibroid. So we talked about the middle layer. The middle layer now is what I'm referring to of the womb, and that's muscle. And so you have a fibroid that grows within that space known as an intramural fibroid. Now that can, depending on its orientation, how it's positioned, which direction it's growing toward, can have an effect on a baby or a pregnancy developing. Because what happens, the key thing that happens is it distorting, or is it changing the lining, the inner aspect of the womb? Is it making the space narrower? Is it making the space less smooth? Is it in some way disrupting the normal architecture within the womb that is meant to hold the baby? If that fibroid is able to do that, then it can potentially affect the possibility of getting pregnant and the possibility of the baby growing normally as it should. So those are the issues around that particular type of fibroid. If it's a small one and it's growing more towards the outside and not really affecting the inner lining or the womb cavity, then it's less likely to cause any problem. But now let's go to the third type. And look, I'm speaking broadly because I just want us to have an understanding, and we're trying to answer this question. The third type that we'd be concerned about, and this is the type that can have an effect on the a pregnancy happening is the one that arises from the inner lining of the womb. So we talked about the outer lining, we talked about the middle, and then we talked about the inner. Now this one affects the inner and is usually known as a submucosal fibroid, and as you can see, it's growing in such a way that it's jutting into the womb cavity, the inner cavity. So again, this can distort the womb lining, the cavity itself. It can affect the size of the cavity, so make it smaller, and so the baby is struggling for where to implant, and when it's trying to grow, there's the fibroid in the way. The fibroid itself can bleed, so it can cause lots of different problems because it's located in a way that it's affecting the cavity, the lining of the inner lining or the inner space of the womb. The other issue that you can have is in terms of location of where exactly the fibroid is placed. Now look at the womb, just look at the womb's shape. If you look at my video which I did on the functions of the cervix, I showed you the shape of the womb as an upside down pear, and it's sort of similar to what you're seeing on this picture. So you can have fibroids happening at the top, this which is known as the fundus of the womb. You can have fibroids going on along the sides. So if you think of the womb as sort of that upside down triangle, so you can have some happening at the top, and then you can have some fibroids going along the side and then towards the tip. Now towards the tip is where I'm referring you to now, because that's the cervix, that's the neck of the womb. The channel as you go down is the vagina, but that's the cervix, and you can see this fibroid, which is a type of submucosal fibroid because it's growing from the inner lining, isn't it? So this fibroid is managing to dangle itself into the vaginal canal through the cervix. So that fibroid has nicely blocked, if you like, the birth canal, hasn't it? You can see if this fibroid grows, assuming the woman can get pregnant and the baby can implant, what happens as the baby grows and the fibroid itself grows, you have the possibility that it can close off the cervical canal, assuming it doesn't do other things like cause bleeding as the pregnancy progresses. So these are the reasons why the location and the type of the fibroids matter when you're looking at the possibility of pregnancy. So please, let's get it straight. It is possible to have fibroids and to fall pregnant and go on to deliver. Many women have done this, but it depends on different things, including the size of the fibroid, the type and location of the fibroid. Those are the issues to consider. So I think we've gone into this at length. Now, with regards to size, she talked about the 4 centimeter fibroid. Now, that's not a huge fibroid by any streak of the imagination, but I would also be interested in where is this fibroid located. So again, this is why answering this kind of questions on YouTube comment section doesn't really help, because you need a lot more information from this lady to be able to work out what's going on and the best advice to give. So while I'm saying that, I would like to remind you that AskAwayHealth has an email advice service that you can use to send to send questions through, and myself or one of our clinicians will respond to your questions. Any question that's health related, you want some guidance, you want some advice, some clarity about a particular health related issue, please send that through to us. I will place the link in the description box below. I'm not very sure if I can share the screen to show that. So we've looked at those issues about the size, location, and the type of the fibroid. So the question, let's go back what we're talking about. How can one get pregnant with a 4 centimeter uterus fibroid? So we've now looked at the issues around a 4 centimeter fibroid. Now let's talk about the treatment. So in terms of the treatment options, the first thing I will say is that if a woman is thinking about getting pregnant, let me take the share off because I think we're happy. I think we're happy with that. The first thing that we would say, if you're thinking about falling pregnant and you've got fibroids, of course, it's important to establish a regular relationship, a regular follow-up with your gynecologist or with your general practitioner in the first instance, and then your gynecologist. Now, there are different treatment options, as we know, for fibroids. There are medical treatments, hormones, surgical treatments. Generally, if a woman wants to have a child and she has fibroids that we consider may have an effect on her pregnancy or her falling pregnant, we wouldn't recommend medical or hormone treatments because you don't particularly want anything that might affect fertility. So what you want is a situation where a woman is not taking any external hormones, or even though they're able to shrink the fibroids, they may have a side effect that might affect her fertility. So that's generally why hormone treatments will not be recommended. And so by and large, the lady's probably left with surgery or surgery alternatives as an option. And I'm going to explain what I mean by that. The surgery that we're all familiar with in terms of fibroids is the myomectomy, which is where the fibroid is removed. And if you remember some of those images I showed you earlier, then and you're having to remove these fibroids to allow the womb space, to allow the baby have the maximal womb space as it's supposed to, in order to implant and then to grow. So you need to remove the fibroid for that to happen, and also to remove any possibility that the fibroid can start bleeding. So surgery and myomectomy, that's the most common. And myomectomy can be carried out either by open surgery, in which case the abdominal wall is opened, and of course, again, this depends on the size and location of the fibroid. But that is one of the older methods. The abdominal wall is opened and then the fibroids are removed via the myomectomy surgery. But of course, more recently, there are things like laparoscopy surgery. You have both conventional and robotic surgeries where specific fibroids can be removed without having too many incisions or wide incisions to the lady's body. And so what that means is that you're less likely to have complications, you're less likely to have a long stay in hospital, but they will still carry complications. And which method suits which woman is subject to discussion with your gynecologist. It is not a one size fits all. Each of us is different. And I've said at the beginning of this that fibroid symptoms and fibroid types and locations are different from one woman to another. And I don't know if I mentioned this, but of course it's possible to have more than one fibroid. So all these things will determine which method best suits the woman. So that's myomectomy in terms of removing the fibroid, and the different methods: laparoscopic or open surgery, robotic or conventional laparoscopy. There is also a procedure known as a hysteroscopy, in which a camera is passed through into the womb, through the cervix, so that you can actually look and have a look around into the lining of the womb, and while doing so, be able to remove any small sized fibroids that you can reach. So this would refer to the submucosal type that I referred to earlier, which are the ones that grow, the types of fibroids that grow from the lining of the womb. So with a hysteroscope, that's that camera that's at the end of this thin tube, it's possible for the specialist to remove the fibroid at the same time that they're looking around within the inner lining of the womb. So that's another method. And again, it depends on the type of fibroid that's present that the woman has. The benefit of this procedure is that it's minimally invasive. Well, it's certainly not as invasive as the laparoscopy or laparotomy, where where a myomectomy is being performed. With the hysteroscopy, the woman can pretty much, once the procedure is over and she's had a few days rest, her cycle continues as usual and she can start trying to conceive. So in terms of time to recovery for the myomectomy compared to the hysteroscopy is less invasive. With the myomectomy, you might find that you're having to wait 3 to 6 months to allow the womb to recover before trying to start to have a baby. So it's really important. And these are considerations that depend not just on what you want, but also the type of fibroid that you have. And the other thing to look at is, the other method to think about is the uterine fibroid embolization. So this is a surgery alternative. Doesn't involve surgery. And what happens is special material is injected through one of the vessels in the blood vessels in the body to kill away fibroids. So it goes directly to the blood vessel that supplies blood to the fibroid wherever it's located, and is able to close off that blood supply to the fibroid. And in that way, the fibroid eventually shrinks and dies. So that procedure procedure is local, it's direct to the fibroid, and women who've had that procedure can go ahead to have children. There are reports, and we do have women who have gone ahead to have healthy pregnancies afterward. Now, please don't forget that all procedures can have some risks. There could be some complications. There have been some reports about issues to do with the placenta following a uterine fibroid embolization. So again, it's an option. It's important for you to discuss with your specialist to see whether this particular method will suit you. But it is an option for a woman who has a fibroid that may have an effect on her pregnancy. So if you're just joining us, we're looking at this question: how can one get pregnant with a 4-centimeter uterus fibroid? And what we've said is that the main issues that come into answering this question are looking at the size of the fibroid and its type and location. Those three things in particular. Other issues may present, previous treatments, an individual's medical background and so on that we're not going into. We're just looking specifically at the fibroid. But these are the issues that will make us look at what options may help best this lady who wants to get pregnant but who has fibroids. And we started by saying that depending on size and location, many women with fibroids do go ahead to have to fall pregnant and to have children. I think we have covered this to a good amount of detail. I think I've covered everything I wanted to say in regards to this topic. So to summarize, I would say it's good to sit down, have a chat with your doctor, whether it's your specialist or whether it's your general practitioner, to look at the options and complications or any risks of these methods. Don't forget that if you've had a myomectomy, for example, there might be a long time to recovery, that is for your womb to recover, so that it can safely carry a pregnancy after the procedure. And that sometimes after myomectomy, even after recovery, there may be a risk of miscarriage or a likelihood that the baby will be delivered by a cesarean section. Not to put anyone off, but just so that we are aware and so we're making informed choice. Please don't forget to like and subscribe, like this video. Again, a reminder that we've got lots of fibroid related topics in the channel. A big playlist about fibroid topics, because I know women worry about this a lot and want to understand the condition, understand what their options are. There are options. We just need to be talking about them and helping women know what is available.